Mr. Chairman?
Yes.
We have no more amendments to this title. We are still working on language modification. You have one more? Well, all right.
Mr. Burgess?
I thought we were through.
Burgess 003.
Mr. Chairman?
Gentlelady reserves a point of order. The clerk will report the amendment and we'll have it distributed.
Amendment offered by Mr. Burgess of Texas. In Title 4, add at the end of Part 2 of Subtitle C the following. Section 4315, Accelerated Incentives. Section, notwithstanding any other provision of this part or any amendment made by this part, the Secretary shall establish a method under which any incentives payments established pursuant to the amendment made by Section 4311 or 4312 shall be available to an eligible professional or eligible hospital, respectively, beginning in June 2009.
Gentlemen, the amendment is before us. Gentleman is recognized for 2 minutes.
Thank you, Mr. Chairman. I'll be very, very brief. But this bill, the stimulus bill that's before us, is to stimulate the economy through a massive infusion of federal dollars, the likes of which we've never seen before, into the United States economy. But the provisions related to health information technology, incentive payments to providers and hospitals, don't go into effect until 2011. So most economic projections I've read or seen have the recession that we're in now will likely be concluded by that time. If we are to accelerate the payments available to providers and hospitals, this new program would be more stimulative in nature, and these dollars will be available much earlier than 2011. By making an early and substantial investment in health information technology, we can help kickstart the economy sooner rather than later, which should be the intent of the legislation we have before us today. Now, Ms. Eshoo noted in her opening statement that we can't fiddle while Rome burns. She said this is as urgent as it comes. Well, since it is an economic stimulus bill, it would make more sense if the payments in this bill went out now as opposed to 2011. My amendment would make the Medicare HIT incentives created in this bill available in June 2009 as opposed to beginning 2 years later, and I'll yield back the balance of my time.
Gentleman yields back the balance of his time. Mr. Gordon, recognized for 2 minutes.
Yeah. Well, I'm, first of all, very pleased that this afternoon and tonight we've established that health IT is important and that it's going to save lives and money. I think that's the good news. With another analogy, Dr. Burgess, we also don't want to put the horse in front of the cart. You might remember back in 2002, this Congress appropriated hundreds of millions of dollars for the states to purchase electronic voting systems before the complete technical system of standards were set up and conformance tests were put in place. And now you're seeing them scrap those. To give you a more local analogy, George Washington University just built a new hospital. They have a health IT system in the emergency room, and they have one in the regular hospital. They can't communicate. And so the reason that there was we do not want to waste money by allowing people to start buying systems before the technical standards are established, and also that the test beds are put together so that that software can be given, for lack of a better term, the good housekeeping seal of approval. We want to get it out the door as quickly as possible. There's money in this bill that helps to accelerate that process to get those standards. And I would, again, I agree with your premise, or whether with your good intentions, but I'm afraid that it doesn't work in this case.
Will the gentleman yield for just one additional?
For whatever time I have, or for a portion of whatever time I have.
I appreciate that. And, of course, you demonstrate so clearly why health information technology does not belong in a stimulus bill. And I will be happy to stipulate that point. That's a point I've made.
Well, first of all, I'll reclaim my time. There are billions of dollars that are being spent up front. There's also, by doing this, it sets certainty in the private sector for them to go ahead and start hiring people, getting ready for this. And so it is, money doesn't have to be spent to stimulate the private sector when they know that it's going to be coming. We want to do this. We want to do it right. I can't imagine that you would want doctors to be spending money on systems that may not qualify later.
Gentleman's time has expired. All time has expired. All those in favor of the amendment say aye.
Aye.
Opposed, no. No. The noes have it. The amendment's not agreed to.